The liver disease incidence is on the rise. And I think the main reasons for this are lifestyle reasons. There is more obesity, there's more people with diabetes and abnormal lipid profile. There are people who are having too much alcohol. I am Arvinder Soin, Chairman and Chief Surgeon of the Medanta Liver Transplant Institute in Gurugram, Delhi NCR. It is of great concern how much the incidence of liver diseases is on the rise. Despite the fact that we have new treatments and new surgeries for helping patients with liver disease, there is a big need for people to understand the causes of liver diseases and to try and prevent them. So the 4 common liver diseases in adults are 1. Non-alcoholic fatty liver disease, 2. Alcoholic fatty liver disease, 3. Hepatitis C, and 4. Hepatitis B related chronic liver disease. Liver cancer is the 5th largest number of cancers that we see in India. And liver cancer happens to people who already have a liver disease from one of the 4 causes I just listed out. Obviously, the way to prevent serious liver disease is to prevent these 4 causes that I've just talked about. So, alcohol causes alcoholic liver disease if taken more than 10 units per week by women or more than 14 units per week by men for more than 5 years. So, excessive alcohol consumption should be avoided. Non-alcoholic fatty liver is basically a lifestyle disease which happens to people who are obese or who have uncontrolled diabetes or who have high cholesterol levels or triglyceride levels, and these obviously should be avoided and treated. Hepatitis B, of course, is treatable. It's also preventable by having vaccination. And hepatitis C, although there is no vaccine for it, but it can be now easily treated with medicines. So if these are detected early, then they should be treated by liver experts before they become serious into chronic diseases. The liver disease incidence is on the rise. And I think the main reasons for this are lifestyle reasons. There is more obesity, there are more people with diabetes and abnormal lipid profile. There are people who are having too much alcohol. So these are all lifestyle problems. And I think that pollution and smoking also add to the misery of the rising incidence of liver diseases. So I think the solution obviously lies in controlling these problems. Now, the way to prevent progression of liver diseases to a serious nature or serious stage is to actually find them and spot them early and treat them when they are completely treatable. See, liver has a lot of reserve. So when the liver is affected initially by, let's say, non-alcoholic or alcoholic fatty liver disease or even hepatitis B or C, there are a few years in which the damage is containable and treatable and reversible. So if one has excessive alcohol, then of course one should stop having it, and you should get a regular liver test done by a liver expert and get an ultrasound done. And if there is a derangement of those tests, then alcohol should be stopped completely. If one has history of liver disease in the family, then again, it would be better to do liver tests and ultrasound every 2 to 3 years. If one has diabetes, which is uncontrolled, obesity and abnormal lipids, then if you control them, then the progression of liver disease can be halted. And of course, the way to prevent liver cancer is to prevent any of these diseases from getting worse. Also, excessive smoking definitely causes liver cancer, as does alcohol. So both these should be avoided. So the way to maintain a healthy liver is to avoid all the diseases that I've just listed out and to have a healthy lifestyle, to have regular exercise, at least 1 hour a day of cardio, and to have nutritious diet. Now, what's a good diet for keeping the liver healthy? Well, whole grain cereals, lots of fruits and vegetables, olive oil, avoidance of red meats, avoidance of any sweet things and sweeteners and very oily deep fried food. Green tea, all these are good things for maintaining a healthy liver. COVID has an impact on the liver health. Now, liver has the same receptors on its cells that the lungs have. That means ACE2 receptors. So the coronavirus also attacks the liver, but liver has a lot of reserve. So in an average case of COVID, liver does not suffer much. However, the liver function tests will go up. The bilirubin and the transaminases may rise. But after 2 to 3 weeks of recovery, these tests come back to normal. So normal people with normal livers will not have much of a harm by the COVID infection. But people who already have diseased livers, their liver disease can get worse. Mild liver disease can get severe, and severe liver disease patients can go into liver failure and urgently need liver transplant. So that has been seen in the recent pandemic. A lot of people have had desi medicines and herbal medicines for increasing immunity in the COVID times. And kada is very common, and giloy juice and leaves are often had. And sometimes these have actually caused liver damage. In fact, we have now seen close to 10 cases where people have had kada for a long time, like 2 to 4 months. And these people have had deranged liver function, and 2 of them have actually gone into liver failure. So whenever one takes Ayurvedic medicines for this purpose, they should be taken from reliable sources, from experienced Ayurvedic doctors, and excess of everything is bad.